A trauma-informed approach plus the conscious life practices plus psilocybin does magic. It's transformative. Microdosing, what I see is it helps you take off layers at a time. Macrodosing unveils everything like an earthquake. So for some people, it can be earth-shattering. And people who have bipolar disorder, who have schizophrenia, who have experienced psychosis and mania, I don't advise them to take it. It's actually contraindicated. They are not included in these big studies. What happens, and I've seen this happen, is that the individual will go to a retreat, they will do the macrodose, they have not taken a proper history, or the individual doesn't know that they have these, diagnoses mostly based in deep trauma of childhood. Regardless, these individuals tend to have more connection with the mystical world. They don't need more of that. They need more conscious life practices where they are grounded and they're exercising and they are running every day and they are meditating, but not even too much meditating because they are already in the mystical world. So we just say maybe 15 to 20-minute max for meditation. Nutrition is highly important in these individuals. Highly, highly, highly. Dr. Christopher Palmer at Harvard is a psychiatrist who uses ketogenic diet in his patients who have severe forms of schizophrenia and bipolar and mania. So psychedelics is not the answer in that group. What I do see in my practice is when the individual is selected properly and they are very committed. I've had physicians who are suicidal who come to me and they've tried ketamine and it hasn't worked for them. And microdosing with conscious life practices work. But you got to have a caring guide. With microdosing too, there is a guidance that goes with that. Each session that you have with even a microdose needs to have a ceremony. I'm talking about a minuscule dose, something that a lot of people don't even feel. They may just feel an uplift because the weight of anxiety or the past has just dropped, and now they can take a deep breath and they can feel more grounded. Now, there are some studies looking at microdosing in people who have bipolar depression, anxiety, but the numbers are very small and the jury's out. So we need a lot more studies in those individuals. And I haven't seen this in any study, but my postulation is that also the amygdala shuts off, which is the limbic system, which is the fear response center, and the prefrontal cortex turns on. I need to look more deeply for research of microdosing, but there just isn't a lot of it. Most research that you see from big institutions like Hopkins, Yale, UC Berkeley, UC Davis, Emory, they tend to be all macrodosing studies.